The design of the ORCHESTRA trial, it was designed about a decade ago when overall survival of metastatic colorectal cancer is about 30 months with systemic therapies, but in multidisciplinary meetings we try to improve patient outcomes with adding local treatment to the systemic therapy. Also because there were new treatment options available that were less invasive, like thermal ablation, stereotactic radiotherapy, but there was no evidence that it was actually improving overall survival. But since it was more and more a point of discussion in the team meetings, we decided to design this trial where we would actually randomize patients between either having only palliative systemic therapy versus both systemic therapy and tumor debulking, meaning local treatment of all metastases present. It took us about 10 years to complete accrual, and after follow-up for overall survival, we saw that there was no survival benefit of adding tumor debulking to systemic therapy in this patient category, who had extensive disease, more than 2 organs involved, with multiple lesions. But also if we focus on specific subgroups, for example, the ones that have liver and lung disease only, or the patients having peritoneal disease, also in these subgroups there's no survival benefit of adding tumor debulking. We even took a closer look to those patients that had a good response to systemic therapy, so for at least 6 months. Also in that patient category, there was no survival benefit of debulking, not if you do it radical or maximal. So I think this is important information that adding these new treatment regimens incorporate those in the treatment of your patient, you have to reconsider the place. All these new treatments emerge and are easily incorporated, but this trial shows if you research the added value of the tumor debulking by randomization, there's no overall survival benefit. So in this patient category, there's no benefit for patients. Also for other patients, the value of local treatment should be reconsidered, preferably in randomized trials.